My name is Dr. Maitreyi Raman, and I'm a gastroenterologist and physician nutrition specialist at the University of Calgary. I'm here to talk to you today about maintaining a healthy weight in IBD. So there was a lovely study conducted about 10 years ago now in patients admitted to Canadian hospitals. In over 1,000 patients, 45% of all patients were diagnosed as having either moderate or severe malnutrition. However, surprisingly, it was only recorded in the medical chart 1% of the time. So this indicates that there is a substantial difference between the actual prevalence of malnutrition and how frequently physicians are identifying it, particularly when admitted to hospital. Now, when you have inflammatory bowel diseases, the prevalence of malnutrition is actually substantially greater. Instead of 45%, between 75 to 90% of individuals are diagnosed as having malnutrition when admitted to hospital. And even in the healthy IBD outpatient who is not admitted to hospital, malnutrition can affect them 20 to 30% of the time. Now, it's important to recognize malnutrition because it is associated with an increased infection complication or infection risk. And this is compounded or magnified significantly, particularly if you are receiving either a biologic agent or are taking an immunosuppressive medication. And infections are increased of all kinds: pulmonary or lung infections, wound infections, urinary infections, amongst others. Having malnutrition also increases the length of stay or length of time that you may be admitted to hospital. And after being discharged from hospital, having malnutrition increases the risk of hospital readmission. If you've had a surgery, malnutrition can increase the risk of wound breakdown, leakage at the surgical site, bleeding from the surgical site, as well as end organ complications, particularly heart or lung failure. Now, when you were receiving a biologic agent like an anti-TNF agent, an example of this could be infliximab or adalimumab, having malnutrition decreases its effectiveness of these medications. So understanding and diagnosing malnutrition is important so you can rectify it and implement strategies to decrease the risks associated with it. Now, there are many reasons for why you may have malnutrition when you're diagnosed with inflammatory bowel disease. First, if you have symptoms such as nausea, vomiting, abdominal pain, bloating, cramping, diarrhea, all of these symptoms may impact your ability to eat adequate normal volumes of food because these may enhance or worsen your symptoms. So food avoidance or decreased food intake may make you feel better, and understandably, you would naturally gravitate to this route. However, persistent declines in oral intake can certainly decrease the amount of protein, calories, and nutrients and micronutrients that you are consuming, leading towards malnutrition. In addition, if you've had prior surgeries as a consequence of your disease, you may have lower limits of small intestine remaining. Remember that the small intestine is really important to help absorb both fluids, electrolytes, nutrients, as well as essentially the food that you're eating. So surgical resections or removal of bowel resulting in shorter bowel can also can result in malabsorption. If you have active inflammation, or if you have a stricture or a narrowing or a blockage in your bowel, all of these things can understandably provoke symptoms as well and also facilitate malabsorption. Being on certain medications, such as steroids, may impact calcium, phosphate, and zinc absorption. And being on certain medications can also interact with other nutrients, leading towards deficiencies. So there are many reasons as to why malnutrition may occur in the setting of inflammatory bowel disease. Now, the prevalence of overweight and obesity in IBD has changed substantially in the past 20 years, very similar to the general population. Now, in a study that we recently completed in Alberta, we identified that 50% of patients with inflammatory bowel disease are either overweight and or obese. This is a dramatic increase compared to the rates even 20 years ago when malnutrition or being underweight was a bigger problem in those individuals with IBD. Being overweight has impact both on IBD, overall natural history and course, as well as on general health. There was a nice study reported on earlier this year and presented at a major international Crohn's and colitis congress. And this group of investigators tried to understand the associations between being overweight as determined by visceral fat. Now, visceral fat is the fat that is located around the organs in the abdomen. It's not the fat that you can pinch under the skin. The investigators, the researchers, they divided close to 100 patients into 4 groups, either having or based on the amount of overall visceral fat in and around the organs. So they were grouped either into having high levels of fat, medium levels of fat into 2 categories, and then the lowest levels of visceral fat. And they followed these patients out for 1 year. And they identified that those patients that had the highest visceral fat compared to the lowest visceral fat were much less likely to achieve inflammatory response based on colonoscopy. They still had active ulcers and active evidence of inflammation if they were in the highest quartile of having visceral fat. In addition, the highest compared to the lowest fat groups were less able to achieve remission and come off their steroids if they were using it because they had active symptoms. So being overweight and or obese may impact your response to biologic and other medications. And this is also in addition to its known detrimental effects on blood glucose control, diabetes, and heart disease. The European Society for Clinical Nutrition defines malnutrition as a state that results from a lack of food intake or impaired absorption that leads to muscle loss, decreased physical and mental performance, and impaired outcomes from disease. And while this definition of malnutrition is interesting and important, it's hard to apply on an individual patient basis. So to help translate this definition into what it actually means for you, there are several nutrition risk screening tools that have been validated that you can even apply in the home-based setting yourself without the input of another healthcare provider. Examples of these nutrition risk screening tools include the patient-generated subjective global assessment, the malnutrition screening tool, the Canadian nutrition screening tool, and there are several others as well. I would recommend you consider using the abridged patient-generated subjective global assessment tool because we have shown that this tool performs as well as when a patient completes it compared to when a dietitian or a healthcare provider completes it. The patient-generated subjective global assessment considers your weight and any unexpected weight loss that has occurred over the preceding several weeks to several months. It considers your appetite as well as your intake, as well as any other symptoms that may affect your quality of life. So although the various screening tools may have subtle differences between them, they all share a similar goal and objective of assessing or providing input into your risk of having malnutrition. If you do this in the home setting and you feel you self-diagnose as malnourished, then please talk to your GI doctor and your dietitian for the next steps in management. An approach to healthy weight treatment first and foremost includes setting treatment goals and weight targets with your dietitian and physician. Now, you need to understand that you may have had significant weight changes since your diagnosis with IBD. So it may not be realistic for you to aim for your pre-IBD target. Therefore, having a clear rationale as to what is appropriate for you is something you should discuss with your treatment team. Now, when being underweight or having lower muscle mass, optimizing your food intake first orally is always the priority. And this can be achieved by including or incorporating small, frequent meals throughout the day rather than larger meals at designated time points. A preference for liquid and or pureed or softer foods frequently is better tolerated, particularly when having obstructions or blockages in the gut. And when having active inflammation, having a nighttime meal or a meal that's richer in protein and complex carbohydrates before bedtime can be very effective because it minimizes the overnight fasting period when protein breakdown or protein catabolism can occur. Now, in terms of what to eat, having an emphasis on protein-rich foods, complex carbohydrates, particularly fruits, vegetables, grains, and legumes, is important. Incorporating adequate amounts of soluble fiber, aiming for between 25 and 35 grams daily is important, as well as an emphasis on healthy fats, such as monounsaturated fats, and aiming for optimal omega-3 to omega-6 ratios, as well as decreasing saturated fat intake. Now, many patients with active inflammatory bowel disease may not tolerate fruits or vegetables, particularly in raw form. So please speak to your dietitian about strategies to improve the texture by peeling skins, removing seeds, perhaps gently sauteing or cooking or exposing your vegetables to heat, blending or pureeing them so that you have the optimal texture that you can tolerate and still retain these important nutrients, which may be important to managing inflammation. Finally, I'd like to talk to you a little bit about exercise and physical activity. Physical activity is an important component to include into your lifestyle together with dietary principles. And physical activity is both important for the underweight, malnourished patient, as well as for the individual that has overweight and or obesity. Physical activity builds muscle mass, and muscle mass is important to improving all those adverse complications we talked about previously, as well as improving quality of life, decreasing fatigue, improving sleep quality, and improving mental health. When having obesity, physical activity can decrease that fat in and around the organs, the visceral fat, and that can have important impact on decreasing overall inflammation to help improve the course of your disease. Physical activity can also improve the gut bacterial profile or the microbiome, as well as the circulating cytokines or pro-inflammatory markers that can perpetuate disease. So please talk to your doctor and your exercise specialist about how physical activity can be incorporated into your daily routine. So in conclusion, I'd like to state that maintaining a healthy weight in IBD is important for a number of different reasons as described in this presentation today. Please discuss your concerns around malnutrition, low muscle mass with your GI physician and or dietitian. And a multidisciplinary team is optimal to provide you with the adequate resources that can support you through this journey. With that, I'd like to thank you for your attention and for having me speak to you today on this important topic.
Hi, I'm Deanna, and I'm a registered dietitian. Nutrition affects not just your IBD symptoms, but your overall health and well-being. And without proper nutrition, the symptoms of your IBD can cause serious complications, including nutrient deficiencies, weight loss, and malnutrition. Protein energy malnutrition is an energy deficit due to a deficiency of macronutrients and many micronutrients as well. It can be sudden or it can gradually happen over time. It is common among patients with disorders that decrease your appetite or impair nutrient digestion, absorption, or metabolism. So people living with IBD are at an increased risk for developing PEM, and that's due to many factors such as reduced oral intake, malabsorption, chronic blood loss and protein loss, and intestinal bacteria overgrowth. PEM can be mild or it can be severe, and in severe cases, hospitalization is common. However, mild cases of PEM can be improved through a balanced diet while avoiding lactose if it causes diarrhea or GI issues. Treatment for PEM often involves replacement of nutrients if you're experiencing nutrient deficiencies, It involves following a high protein, high energy diet, and it also involves resistance training to build and maintain your muscle mass. So how do we do this? Some practical strategies to achieve this include eating 4 to 6 small meals or snacks every day, or eat every 2 to 3 hours. Eat the protein part of your meal first to ensure that that protein is being eaten before you feel too full. Replacing tea, coffee, or water with milk or milk alternatives to drink your nutrition. Preparing bulk meals and freezing leftovers on days where you feel more energized, and stocking your cupboards with convenience foods that you can turn to when you're feeling less energized. Don't get too caught up on organizing your meals. So for example, eat any suggested meals or snacks at any time of the day, like dessert for breakfast or cereal for dinner. And last thing is to fortify your foods to enrich the nutritional content. So this means adding additional energy and protein to your meals or snacks without increasing the volume or size of those meals or snacks. So this means that you'll get more bang for your buck. So each mouthful that you take is as high energy and protein as possible. So some examples of fortifying your foods would be using something like powdered milk or skim milk powder. And this is something that is very versatile. You can add it to milk, soups, oatmeal, yogurt, smoothies, coffee, tea, mashed potatoes, puddings, sauces. And you can also use it for baking muffins, pancakes, breads, cookies. It's very, very versatile. So I always recommend skim milk powder to my patients who are trying to maintain muscle mass or gain some extra weight. You can also make a high protein milk recipe with the skim milk powder, and it's just simply 1 cup of milk or milk alternative plus a 1/4 cup of skim powdered milk and then a teaspoon of vanilla for some flavor. Other ways to increase your energy and protein is by adding energy-dense foods like avocado, nuts, and nut butters, oils, eggs, tofu, cheese to your everyday meals and snacks. And finally, if you continue to lose weight unintentionally, your dietitian can recommend some protein powders or oral nutrition supplement drinks like Boost, Ensure, or Resource. Some sample meal ideas to get you started would be avocado and egg on toast, strawberry smoothie fortified with powdered milk and nut butter like peanut butter or almond butter, roast chicken, mashed potatoes, and mixed veggies, and make sure you're eating that chicken first, like I mentioned, the protein first. Also veggie sticks with some type of creamy dip or soft cheese dip, cream soup with garlic bread, and finally chocolate milk. Now I'll chat about some practical strategies to improve your food intake when you are feeling unwell or you're symptomatic. Eating with IBD is very individual, and it's really important to figure out what works best for you so that you can minimize your symptoms and maintain good health. There are, however, some basic guidelines to help you decide how and what to eat, especially when your disease is active. If you're experiencing symptoms like diarrhea or nausea, sticking to more bland foods will help, like crackers, toast, potatoes, or rice. Eating very small meals will help, and consuming high fluid content foods like soups, smoothies, high protein jellos, or puddings will help if you're experiencing diarrhea or vomiting. Try to follow a high protein, high energy diet plan to make sure what you do eat is nutrient packed. Do not skip meals, even though it may be tempting to avoid discomfort or some symptoms that you're experiencing. Restricting foods or skipping meals can lead to nutrient deficiencies and further lower your appetite in the long run, potentially worsening your symptoms and leading to undernutrition. Small frequent meals, so 4 to 6 meals per day, can help promote your appetite. Keeping hydrated is really important when you're experiencing symptoms. So drinking enough to keep your urine a light yellow to clear color. So this could be with water, broth, tea, or soups. Preparing meals in advance and keeping your kitchen, freezer, and pantry stocked will also help when you're experiencing symptoms. And finally, incorporating some meal replacements or multivitamins can be really helpful if your appetite is low and you're feeling very symptomatic. And that's something that you can talk to your dietitian about, choosing the right ones for you. What does a healthy weight management plan look like? Well, maintaining a healthy weight can be challenging for people with IBD. Weight loss is common, and there are many factors that can lead to it. Finding out why is important to find the right solution for you. As with everything with this disease, there's no one-size-fits-all weight management plan, but there are some common strategies that can help achieve and maintain a healthy weight. Like I said, there's no one size fits all, so it's different for everyone, and it's based on your current nutrition status, disease state, and any comorbidities that you may have. So it's really important to work individually and closely with your healthcare team. Physical activity is really important to maintain a healthy weight. And exercise can not only help with that, but it also improves your overall health, can help strengthen your immune system, relieve stress, and improve your psychological health. If you are in a flare, consider some low-impact physical activities like walking, yoga, or some at-home activities. Next, following Canada's food guide, Healthy Plate Model for meals and snacks can be helpful. Using the proportions of foods on the Canada's food guide plate is a great tool to help make sure that you're having some healthy meals and balanced snacks. And to use Canada's food guide, you have to start with making half your plate vegetables and fruits. Veggies and fruits should always make up the largest portion of your foods that you eat throughout the day. Next, make 1/4 of your plate whole grain foods or high fiber foods. And finally, make the other quarter of your plate lean protein foods. For snacks, it's important to include a source of protein and fiber, so like cheese and crackers, celery with peanut butter, or veggies with hummus. Do not restrict foods, so there's no need to avoid foods unless they worsen your symptoms. It's best to restrict as few foods as possible so that you can increase your chances that you're getting a balanced and nutritious diet. This is important for maintaining the function of your digestive tract, your overall health, and your weight. Finally, my last tip is to keep a food journal. This helps you really pinpoint specific foods that can exacerbate your symptoms with IBD. So keeping a food journal can really help when you're trying to maintain a healthy weight.
Hello, my name is Dave Mcguire and I have Crohn's disease. I have had Crohn's disease since I was 18 years old and I'm now 29, so it's been a little bit over a decade. To go into whether or not I find if nutrition, diet helps, I do believe it does. I basically altered my diet from the start of my initial diagnosis, going from kind of lactose-free to corn-free to red meat-free to gluten-free, so kind of all the general steps, we could call it, that a nutritionist slash dietitian slash reflexologist, naturopathic doctor suggested. And on the whole, most of it kind of did not make that big of a difference, but I did find that removing large quantities of dairy and going gluten-free did make a pretty substantial difference. Flash forward to about 2 years ago, I had surgery where I had my appendix, several feet of my large intestine, and several inches of my small intestine removed. It was a right hemicolectomy. After that surgery, I found that it was fairly difficult to digest any form of gluten, so I just cut that right out entirely. There was periods of time where I played with having it back in and out. So I do believe that diet does play a fairly large role in managing both signs and symptoms of IBD, especially Crohn's for myself. But with that being said, I don't think that just having a clean diet for myself would have worked. I have had some medication to help along the way. I am on a biologic, largely due to the way that I have had my course of Crohn's disease. And I also think that it's very individual specific. We know that there's specific lifestyle factors and genetic predispositions, but we can control some factors within what we consume. So obviously not having something like McDonald's or drinking alcohol or smoking to help mitigate general feelings of inflammation and feeling kind of sickly, if you will, definitely plays a role. As far as obesity and malnutrition goes, I find that I don't exactly think that it's my place to give a true statement or discussion on that, given that I'm not a dietitian, I'm not a doctor. I work as a strength and conditioning coach, so I'm more than aware about fat loss, weight gain, moderating such areas. But as far as it goes for somebody who is struggling to gain weight due to a digestive disease, I don't think that that's kind of within my wheelhouse. But I will say that as somebody who did struggle to gain weight, finding foods that work for you is going to be the biggest and best thing versus following something that you either read on Google or you watch some YouTuber post about. So pretty much finding what works best for you is going to be the best thing. As far as obesity goes, I know that it is equally as easy to gain weight once you are in remission as it is for a normal individual. So a very varying diet and exercise regimen, just like any normal individual, is not something that is beyond the scope of somebody with IBD. So for me, it doesn't make sense to treat said situations any differently. I try to treat myself as a normal, active, functioning individual. And outside of having the occasional flare, I am in remission largely due to exercise and what I am consuming. So I do try to stay active, and I do believe that the majority of the population, Crohn's, colitis, celiac, GERD, any other IBD related individuals should also be doing the same thing. Okay, thank you for your time.
My experience with malnutrition as a Crohn's disease patient is pretty extensive. When I was first diagnosed, I ended up losing a lot of weight, about 20 pounds in a month and a half, and it was really scary. And that was from diarrhea, vomiting, nausea, just an overall low appetite, and just feeling unwell. So a lot of the things that I chatted about and many of the strategies that I chatted about really helped me when I was dealing with my period of being malnourished and losing weight. I used powdered milk, I used meal replacements, I was making sure I was having multivitamins every day, I was talking with my doctor. It was really important to make sure that I followed my own advice when I was experiencing malnutrition. So it does help, and I have firsthand experience using these strategies to help me get back to a healthy weight and just overall healthy and happy.